Someone asked me to talk about the difference between heart attack and cardiac arrest. He said I should explain it in a simple way that he will understand. So I'll try to do that. By the way, have you followed me across all social media platforms at Nurse Etta? Nurse Etta. Okay, let's get down to this, okay? So, cardiac arrest and heart attack. Sometimes we use these two words interchangeably. So sometimes we use this instead of this, or we use this instead of that. But there's there's some difference between these two. But let me explain it in a way that we will understand. And if you still don't understand it at the end of this, let me know at the comment section, and I'll try another way to see if you'll understand that better. Okay, now cardiac arrest, just take cardiac arrest like an electrical problem. You have electric in your house, you plug the socket, it's not working. You ask, why is it not working? And then heart attack is like a circulation problem. You know, like the circulation, like where the blood moves around the system. So there is something that is stopping the blood from circulating inside our body, and that is what heart attack is. I'm just trying to make it in a way we'll understand, okay? So, first of all, let me show you. This is an image of a normal artery. So this is an artery in our body where the blood, you can see this, the blood flows freely because this one is normal, no problem. Now look at this. This is an artery that has problem because it is blocked. So this is a blocked artery. So you can imagine something has blocked it, reducing the lumen, the opening through which the blood will pass. Now, I also want you to look at this. This is a blood clot. It could be from anywhere, maybe from your leg or from anywhere, or from any wound, or some that has, detached from somewhere. A blood clot. Imagine this blood clot coming to this place that is already tiny and enter here. It will block this tiny part, so there will be no blood going up and down. Do you get the gist? Okay, let's carry on. Now, this is a diagram of a heart. Please don't say anything. I'm sure by now, if Nursing Council sees this, they'll be asking and wondering, how did this one pass NMC? How did this one pass Nursing Council? Who gave this one license? It's okay, please ignore this diagram, okay? Just try and get what I'm telling you. Now, let's get back to this. Remember, we are talking about the difference between cardiac arrest and heart attack. So, I've drawn this thing here. I'll put this here for you to see cardiac arrest as an electric problem, an electrical problem. So, this is cardiac arrest. This is the heart. There is, for Niger people, NEPA don't take light. So imagine plugging this socket. Just imagine, say this in a heart. You don't plug this socket. When like electrical impulse should run from the SA node, the AV node, the bundle of his Purkinje fiber and all that. That will help the electrical impulse. That will help to squeeze, to tell this the muscles here to squeeze so that blood can keep going, keep flowing to our body. NEPA don't take light. So in cardiac arrest, there is power outage. There is no power. There is no transmission. So the heart stops beating. So what happens is that because of any problem in the heart, that I can make in a different video. If you want me to talk about what are the causes of heart stopping to beat, let me know. I can do that in a separate video. But just understand that cardiac arrest, in this case, NEPA don't take light. There is no transmission in the heart. The heart is not getting any signal to help the muscles to squeeze. It don't collapse, it don't die. That is cardiac arrest. That is when CPR and the defibrillation machine. So that's why CPR is involved to rehabilitate, to wake this heart up, because the heart don't go sleep. And if you allow the heart to sleep for a few more minutes, from there, that person goes to the land of no return. Did that make sense? Okay, now let's go to the heart attack. What is heart attack? Now, heart attack means that, remember this heart, there are some muscles. Okay, there are some muscles that supply, that there are some muscles that help this heart to squeeze, and those muscles, there are blood supply to them. So when one part of that muscles, the blood supply that supply energy, food and oxygen to them, when any of them gets blocked, so there will be no food or energy going to the heart muscles, the heart will be attacked. It doesn't stop the whole heart from working, so they will still work, unlike this one where there is no performance at all, no functioning, they are dead, they are collapsed. Okay, but in heart attack, part of the heart is still working, but part of it is attacked. Part of the heart is disturbed. You just take it like tap. I just drew this thing like tap. You know, like when you turn on the tap, maybe there's a clog somewhere, but there's still water coming out. The water is not flowing very well. So, but because there's a clog, you need plumber to remove that clog so that the water can run freely. That is what happens in heart attack. So parts of the blood supply to the heart is being attacked, and there's limited blood flow through it. Now you can have, somebody can start having chest pain, dizziness, fainting and all that. The person can still continue to live, but it can be treated. It is not like cardiac arrest where there is no function, there is no activity, there is no electricity going on. So here it can be managed to be corrected. However, there can be complete block. Remember, there are some arteries, maybe about 3 arteries or so, that supply this. So the severity of the heart attack will be dependent on how much of those arteries that are blocked. So if some part of it is blocked, you have that chest pain, you know, you can be treated and it will settle. But if it is a complete block, like all of them don't block, nothing is passing through it, and then there's a big problem, because it will probably make the heart muscles, because they are starved of food, they are starved of energy, they are starved of oxygen, right? So they must start behaving in a funny way, you know. They might, especially the ventricles, they might start, you know, pumping or contracting in a funny way that is not healthy for this heart. Okay, when that happens, and let's say there is a complete blockage, if that happens, the heart can get tired and fail. So this, in severe cases, can lead to this, but it's different. So let me summarize. In cardiac arrest, there is no electrical impulse to the heart that will stimulate the heart muscles to function, to pump blood around. In heart attack, a part of the blood supply to the heart muscles that help the heart to squeeze out blood, some blood supply to the heart muscles are interrupted because of a blockage. So it will not cause pain, but it doesn't involve, so most times it doesn't involve the whole of the heart, because the heart will still be working, unless it becomes too much and a lot of maybe all the arteries get blocked. Then that is when all the hearts will be affected. Does this make sense? If you have anything to take away, I need you to take away this. Cardiac arrest is a complete outage, power outage. So there is no electrical activity going on, and the electrical activity is the thing that helps to send signal to our heart muscles to say pump, 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 and they will pump, right? But in heart attack is a circulation problem. Something has blocked the pathway, the arteries that supply food and oxygen to the heart muscles, and they will start hurting, and that is the pain, the chest pain we have, and it can be partial, and in severe, very severe cases, it can be complete. So this is the end of this topic. Let me know on the comment section if it's clear enough, but if it's not, let me know on the comment section, and I'll do it some other way. just to make all of us understand what really goes on, or the difference between cardiac arrest and heart attack. This is me, Nurse Etta, your favorite nurse. Follow me on all my social media platforms at Nurse Etta. And thank you for watching. Have you subscribed? Have you followed my pages? Please subscribe to my YouTube and follow my page on Facebook, TikTok, and Instagram. And thank you so much as do that. Love you. Stay healthy. Your health is your wealth. I love you.